video presentation from Department of Panchakarma, Sindagi Shantireshwar Ayurvedic Medical College and Hospital, Haveri. This video is about applied Panchakarma in Rakta Pitta. Introduction about Rakta Pitta. Rakta Pitta is a Tridoshaja Vyadhi mainly involving Pitta and Rakta. It is classified under Mahagada by Acharya Charaka. Nirukti. According to Madhava Nidana, Pittena Dushtam Raktam Rakta Pitta Mityuchate. Rakta means blood, Pitta means aggravated dosha. Definition. Raktam Pittena Dushate Yatra Saha Rogaha Syata Rakta Pittam. A condition where Rakta is vitiated by Pitta is termed as Rakta Pitta. Nidana of Rakta Pitta. It includes Ahara, Vihara, Manasika. In Ahara, Viruddha Annapana, Katu Amla Lavana, Shara Ushna, Atividahi Yavaka, Uddalaka, Koradusha, Masha, Kulaka. In Vihara, Ayasa, Atisevana of Vyayama, Atapa, Vyavaya. In Manasika, Krodha, Shoka, Bhaya. Purvarupa, Annabilasha, Shitakamikam, Bhuktasya Vidaha, Kanda Dhumayanam, Vami, Shuktamla Gandharasa, Udgara, Swarabheda, Gatranam Sadanam, Paridaha, Samprapti of Rakta Pitta, Hetu Sevana. It leads to Vriddhi of Pitta. It increases Tikshna Ukshna Guna. It leads to Dushti of Rakta due to Pitta. It damages to Raktavaha Srotas and it leads to Rakta Pitta. Samprapti Ghataka. Dosha Pitta. Dusha Rasa Rakta Mansa Sira. Agni Rasa Rakta Dhatuvagi. Srotas Raktavaha Srotas. Udbhavasthana Amashaya Raktavaha Srotamula. Rektasthana Urdhvo Adho Bhaya Srotas. Adhisthana Yakrut Pliha. Rogamarga Bhaya Abhyantara Rogamarga. Vyadhi Swabhava Ashukari. Bheda. According to Marga Bheda, Urdhva Rakta Pitta, Adhoga Rakta Pitta, Ubhaya Rakta Pitta. According to Dosha Bheda, Vataja Rakta Pitta, Pittaja Rakta Pitta, Kafaja Rakta Pitta, Vata Pitta Rakta Pitta, Vata Kafaja Rakta Pitta, Pitta Kafaja Rakta Pitta. Urdhvaga Rakta Pitta. When vitiated Pitta due to its Ushna Guna and Tikshna Guna, it vitiates Rakta and pushes it upwards. It causes bleeding through nose, mouth, ears and eyes. Lakshanas of Urdhvaga Rakta Pitta. Netra Srava, bleeding from nose, epistaxis. Mukha Rakta Srava, bleeding from mouth, hemitemesis. Netra Raktasrava, bleeding from eyes. Karna Raktasrava, bleeding from ears. Kasa Shwasa, kapha and breathlessness with blood. Adhoga Rakta Pitta, the bleeding that flows downward through stool, urine, female through the vagina yonisrava is known as Adhoga Rakta Pitta. Lakshanas of Adhoga Raktasrava. Malena Saha Raktasrava, bleeding in stools per rectum. Mutra Raktata means hematuria. Rakta Yoni, abnormal uterine bleeding. Garbhashayagata Raktasrava, bleeding per vagina. Ubhaya Rakta Pitta, when vitiated Pitta moves both upwards and downwards and it vitiates Rakta, resulting in bleeding from both directions. This condition is known as Ubhaya Rakta Pitta. Ubhaya Rakta Pitta Lakshanas, combination of symptoms of both Urdhvaga and Adhoga Rakta Pitta. Bleeding from nose, mouth, ear, eyes, bleeding in urine, stool and uterine bleeding. General symptoms like Taha, Trishna, Brahma. Lakshanas of Vataja Rakta Pitta. Syava, Aruna, Safenam, Tanu, Ruksham. Lakshanas of Pittaja Rakta Pitta. Kashayavam, Krishnam, Gomutra Sanivam, Mechaka, Agraduma, Anjanabham. Lakshanas of Kafaja Rakta Pitta. Sandram, Pandu, Sasneha, Pichilam. Upadrava of Rakta Pitta. Daurbalya, Arochaka, Vipaka, Shwasa, Kasha, Jwara, Atisara, Shofa, Shosha, Pandu, Swarabheda, Murcha, Kandasya Veda, Bhuktecha, Anna Vidaha, Adruti, Shirasicha Davanam, Putti, Nishtivanam. Sadhya Sadhyata of Rakta Pitta. Sadhya, Eka Dosha Gunam, Urdhvagam, Eka Margam, Balavato, Navati Vegam, Nava Uditam, Sukakale, Nirupadravam, Yapya, Dvidosham, Adogam, Shantam, Shantam, Prakuprati, Margana Margam, Charet. Asadhya of Rakta Pitta. Tridosham, Mandagne, Ativega, Kshina Deva, Vriddha, Anashnata, Ubhaya Margam, Samshrita Kapha, Vatagam, Kande Sadhyati, Upadrava Samyukta. Treatment principle. Charakacharya has suggested that initially no attempt should be made to arrest this bleeding, through which vitiated doshas are getting expelled out of the body. In Urdhvaga Rakta Pitta, Tarpana is given first and Adhoga Rakta Pitta, Peya is advised first. In aggravated dosha condition, Vamana is indicated for person with Adhoga Rakta Pitta. Virechana is indicated for person with Urdhvaga Rakta Pitta. In conditions like loss of strength, emaciation, pregnant lady, old age, Vamana and Virechana is not advised. In such conditions, Shamana Chikitsa is advised. Panchakarmas in Rakta Pitta. Vamana, Virechana, Niroha Vasti, Anvasana Vasti, Uttara Vasti, Nasya. Vamana indicated in Adoga Rakta Pitta. The Vamana Yogas are Madana Phala Yogas, Vamana Panchaka, Madana Phala with Madhu and Sita, Kshira, Sita and Jala, Shaudra, Madhukodakam. Virechana, Trivrut, Shamakashaya with Sarkara, Trivrut Adi Modaka, Trivrut Avaleha, Niruha Basti, indicated in Gudamarga Rakta Pitta. Anuvasana Basti indicated in Gudamarga Rakta Pitta, Esti Madhugruta, Draksha Madhu Sarkara Siddhavruta. Uttara Basti indicated in Mudramarga Gata Rakta Pitta, Shatavari Kshira Rakta Pittara Dravya Yukta. Nasa indicated on Nasagata Rakta Pitta, Kshira with Samasita Jala, Kevala Sita Jala, Dadima Pushparasa, Shalmali Pushparasa. Shamanaushadhi Kashaya, Vasakadikvata, Padmakadikvata, Churna, Laksha Churna, Usiradi Churna, Asava, Draksha Rishta, Lodrasava, Usirasava, Grita, Vasa Grita, Palasha Grita, Audumbara Grita, Avaleha, Kanda Kusumanda Avaleha, Patyas, Anarupa Patya, Shali, Shastika, Nivara, Priyangu, Mamsarasa Rupa, Kapota, Lava, Yena, Harina. अपत्य शाखा वर्ग रसोन वर्तक शिंबी तिला माशा दुग्ध दधि दधिमांद लवण पिष्टान पंचकर्म विहार अति व्यायाम. Modern correlation with Rakta Pitta can be correlated with various hemorrhagic or bleeding disorders in modern medicine depending on its type and severity. Epistaxis, it correlates with Uttaka Rakta Pitta when bleeding is from nose. Common causes: hypertension, trauma, infections, platelet dysfunction. Hematemesis, vomiting of blood, it correlates with Urdhva Rakta Pitta from mouth due to upper gastrointestinal bleeding seen in peptic ulcers, esophageal varices, liver cirrhosis. Hemoptysis, coughing blood, it correlates with Urdhva Rakta Pitta from respiratory tract tuberculosis, bronchiectasis, lung cancer. Hematuria, blood in urine, it correlates with Adhava Rakta Pitta due to urinary tract infections, kidney disease, stones. Melena, it correlates with Adhava Rakta Pitta seen in ulcers, polyps. Ecchymosis, it can correlate with Ubaya and Adhava Rakta Pitta seen in thrombocytopenia, dengue fever. Investigations: CBC, clotting test, liver function test, endoscopy, imaging, CT, MRI. Treatment of bleeding disorders: general supportive measures, IV fluids, oxygen therapy, blood transfusion, identity and control bleeding source, pressure surgery. Specific treatments: thrombocytopenia, platelet transfusion, corticosteroids, hemophilia A or B factor 8 or 9 replacement therapy, vitamin K deficiency, vitamin K injection. Thank you.